And here with me now is Lisa Macon Harrison, Public Health Director for Granville-Vance Public Health. Lisa, thanks for taking the time to join us today.
Glad to be with you. Thanks.
So we just saw how the vaccine rollout's going in Wake County. How about your community? How are things going up there?
Yeah, so Granville and Vance counties are just north of Durham and Wake, a little bit smaller population to serve, which surprisingly has been a really nice way to kind of go through these first three groups a little bit faster than we even expected. But progress is being made daily. Our nurses are working hard, getting shots out to the people, and it's kind of an exciting time.
So how do you go about balancing getting shots to Group 3 educators and frontline essential workers while also working through any potential waiting lists of folks in Group 1 and 2?
Well, we have a number of ways that people can register for vaccine. One is our hotline that we have available on our website at gvph.org. Another is that we reach out and work with our schools, work with our counties, our cities, our business and industry, and make sure that we're getting people in who qualify in these first three groups. As I said, we've made really good progress for groups 1 and 2, the healthcare workers, and also those 65 and older, which we will continue to allow to come to all of our vaccine clinics moving forward. And we do have a handful of each of those groups who just decide now maybe that they would like the vaccine. So it's working to be able to roll in new groups as we continue to serve the groups that we've already made good progress in.
And we've heard a lot about supply challenges with this vaccine. What are some other struggles or challenges that you all have faced in trying to get the vaccine out in your community?
Well, I heard someone, actually the health director in Fulton County, Atlanta, Georgia, said on a call yesterday that it's not vaccine hesitation she worries about, it's registration frustration. So I think all of us are, trying to find the easy buttons, wanting to make sure that we get people in as easily as possible to vaccine clinics and we don't put up any barriers. And yet, we are in the 21st century with a lot of electronic systems helping us out, helping us with keeping up with the first dose and then the second dose for people, which is important. So the registration process is just one of those things we have to work through, but I would say that certainly adds complexity. The other thing is just the 2-dose regimen for both Pfizer and Moderna, making sure people get that and come back on time.
As a rural community trying to roll out this vaccine, what kind of unique challenges do you face that maybe an urban community like Raleigh or Charlotte may not have to worry about?
Well, certainly we always are working with the lack of transportation systems in a rural area and the need for people to be able to have different hours other than 8:30 to 5 every day to be able to access vaccines. So we're trying to offer weekend vaccine clinics as well as, like I mentioned, reach out to partners. We worked really closely with the Senior Center early on, which was a rousing success to try to reach areas that might have been a little bit more difficult for us to get people into a vaccine clinic. The Senior Center helped us with that. We also have a local sort of regional Cartar area transportation system, carts willing to bring people in for vaccine, and that's also helpful. But certainly the outer reaches of rural areas are always places that we want to make sure that we have access to healthcare and vaccines, and we work hard to try to do that well.
And as you know, the next group up is Group 4, adults with high-risk medical conditions. Governor announced this week that could begin as soon as March 24th. Do you see that as a realistic timeline?
Yes, I do actually. We were able to work with our Granville and Vance County school systems as well as our charter and private schools over the last 2 weeks. We should wrap up our school system employees this Friday in a large clinic we're having in Henderson, and we will be ready to continue on with Group 3 until March 24th when Group 4 starts, and I don't see any problem with that.
Excellent. Lisa, thank you for taking the time. We appreciate your insight.
Yes, thanks for having me.